Hi, I'm Dr. Mukesh Gupta from Lenest Malad. Diabetes in pregnancy, an issue which can really be a lot of trouble during the course of journey of pregnancy. Now, let us understand today why does this problem become a big problem? What are the predisposing factors which can lead to that? How do we come to know that we are going to have this problem or we are having this problem? What is the impact of this problem on the mother and the baby and the journey of delivery, that is a delivery process? So let us try to understand this one by one. First of all, who are at risk of landing up with this problem? All those women who have got a strong family history of diabetes, or they have had a diabetes, gestational diabetes in the earlier pregnancy, or if they are pre-existing diabetic or borderline diabetic in this course of pregnancy, if they have had past history of polycystic ovaries, or in prior delivery they have had a stillbirth or similar such things, a large size baby. These are the various different things which can predispose them for having diabetes. Of course, multiple gestations, etc., are also another worry that we have. Now, how do we come to know that a woman is suffering from diabetes? What is the standard process or protocol that is being followed? The most common process, or the screening test we call it, the glucose challenge test or glucose screening test that we do during the pregnancy, is by giving a woman a 75-gram sugar packet and asking her to get her sugar levels done after 2 hours. How do you do that? As per the WHO guidelines, a packet is given to a woman and she is requested not to have any food or drinks after that. And following 2 hours of consummation of that particular packet of glucose of 75 grams, we collect the blood and we send it to the lab for checking. And that tells us if there is a high risk. If her sugar is more than 140, we are a little worried and we put her to the next important thing, that is a glucose tolerance test, a complete thorough checkup whether her sugar is abnormal or not. If it is less than 120, we are not worried. But if it is between 120 and 140, we would like to keep a close watch, and that is what we call as, there might be a possibility of intolerance to glucose. Why does this happen during the pregnancy? And what is the main reason that we are concerned about it? During the pregnancy, the woman has a little difference in the metabolism of sugar and glycogen. What happens is that the body requires extra sugar in the circulation so that it reaches the baby for its growth and development. At the same time, the amount of sugar which is there in the circulation stimulates the formation of insulin, which in turn pumps the sugar into the cells. Now, there is some sort of resistance which is created during the pregnancy. The reason is because Mother Nature wants more sugar going to the baby for the growth and development. And that is where the whole problem sets in. Another very important thing during the course of pregnancy is that we need to pick it as soon as possible. Because what is the impact of abnormal sugar levels on the baby? It can lead to higher chances of abortions or stillbirth, and also leading to higher chances of abnormalities or defects in the baby. Now, the commonest thing that we come across is increased weight gain of the baby, and the baby is a huge baby. And when somebody says and walks in and says that, oh, my baby is like 4.5 kgs and plus, we are worried. The first thing we see is check her sugars. That's another very important thing that we are worried. Also on sonography scans, sometimes we see increased water and increased large size baby. And that is another thing where we are having our alarm bells ringing that, okay, this is something which we need to keep a close watch on. Even if the sugar levels are good, we keep a track that they don't deteriorate. What is the impact on the mother? Well, diabetes is a multi-organ system disease, and it can impact any and every system of the body, whether it is a pregnancy or a non-pregnancy state. It can affect from head to toe. It can affect the vision, retina, your kidneys, etc., etc. Let's not get into that, but most important thing then is that what is the impact on the labor? Most often than not, because of the increased weight of the baby, you may have a situation that these women who are suffering from diabetes in pregnancy may land up with unfortunate cesarean section. But it's not that they can't have a normal delivery. They also require close monitoring towards the last months of the pregnancy, because there is a risk of baby suddenly stopping inside because of the various issues and complications related to sugar control. Lastly, when do we check for these things? Now, the best time to check internationally, it is considered, is 24 to 26 weeks for gestational diabetes. But if we do not check it in the beginning first trimester for a sugar screening, we may miss out on a pre-existent or a borderline case of diabetes mellitus who land up getting pregnant. So that is the reason the sooner you get the levels checked done for sugar, the better it is for us to pick up and thereby control the sugar. The last statement is that what if I do have gestational diabetes? What will be the long-term impact and how will I manage the pregnancy? Well, if you do have this particular problem, it is not something that will prevent you from having a healthy baby totally. You can have healthy baby, and by saying this, I'm saying that you need to control your sugars, you need to control your lifestyle, you need to have an appropriate exercise routine or burning your calories routine and all those things which will help you to maintain your sugar levels at appropriate desired level, and that will definitely give you a healthy baby. What about long-term impact? If I have been diagnosed with gestational diabetes, doctor, will I get diabetes all my life? Well, it is not necessary that you will have that, but your probability of lining up may be a little more than the rest of the population, there's no doubt about that. But still, it can be easily managed and easily controlled. But the most important take home message here is discipline. If you maintain an appropriate levels of sugar, you will definitely have a healthy baby. Thank you very much.